Namaste all. I hope you had a great day yesterday. Today we'll be going to deal with antenatal diet. So especially this pregnancy diet is very, very important because yesterday also we discussed because a lot of medicines, every supplement medicines we cannot give in the pregnancy, but it is very essential to have all the nutrients. So in yesterday's class, one more point, it is not very important. I don't know how important it is, but it is very important to me as a practitioner, which I have faced recently. Uh, the incident is I got a client for the infertility. It was for 3 to 4 years. We were doing treatment, meditation, diet, all those things, and always the lady was sad. So one day I just had a discussion with her in a Zoom meeting. We had a discussion, and always husband will be there with the discussion. This time I told her, just you come for the discussion. So that time she opened up with me and she mentioned her husband is not interested in sexual act and she is having the sexual position above the husband. So that is the first reason not to get a proper conception. So then I got to know that she is not in a proper position for having the sex. So there was some family problem and all because of that this problem was happening. So this she never opened up with me. After 3 to 4 years with constant talking, constant therapies and all these discussions, she opened up at last to me. So then I explained her, this is not the way. So whenever you are having a couple, always, yesterday we mentioned the time period when you have to have the sex, how presentable and all. You should don't feel shy. You should explain the position also. The position should be the lady should be lying, the husband should be above. Then only the proper lodging of sperm to the fallopian tube will happen. See, on the day of sex, we don't know whether ovum is there in the fallopian tube to get fuse or the conception. We are making sure that the sperm is correctly lodged in the fallopian tube. So it stay there also for 24 hours. You know, the time period of sperm in fallopian tube. So position of sex is also very important. Don't feel shy. Whenever you're having a counseling session with your clients, explain this too. So this yesterday I missed out. So I would like to say this also. So today we'll discuss the antenatal diet.
Ma'am, quick question about the yesterday's class. You mentioned about the briefly about the diet before
Yes.
conception. You
Yes.
mentioned about walnuts and nuts, right? So do the walnuts
Yes.
also need to be soaked like almonds?
Yes, all the nuts should be soaked. Only exception is for the seeds. Seeds you can roast. All the nuts, because once you dry the fruits or dry the whatever the constant, water content in that dry fruits is completely absorbed. So that is something which makes hard to digest in your body. Just think you had a rusk and you think you had a some cooked soft bread. How you feel? You feel bloated with rusk more than a softed bread. So we are making the little bit of moist content in the food. That's why it is very important to soak all the dry fruits. Only exception is for the seeds. You can roast and have.
Thank you.
Yes, yesterday I hope I have mentioned you can drink the water of all these soft dry fruits, resins, apricot, anjeer, or the fig. That soaked water you can have. But you should not have the nuts, that is cashew, badam, walnut, all these nutka water you should not have. Because once you soak these nuts, there is an acid, phelinic acid in the outer ring of the nuts. It is released to this water. That will be difficult to absorb the iron in the body. So you should not consume that. Any other question for yesterday's class? Okay, so today we'll discuss with the antenatal diet or the prenatal diet. So before starting, I would like to say a few overall thing about the nutrition, which I call it as ABC of nutrition. This is applicable for everyone, not only for the pregnant lady. You should understand every body is different and have different metabolism. For few people, by drinking only milk, they get purgation or they go to toilet 2 to 3 times. Few people no. Few people garlic is allergic. Few people no. So this is the basic thing. Everybody is different. You should understand that and you should not follow any kind of stupid trends. I say it's stupid trends because people are they just see in Instagram or YouTube drinking raw like fresh juice, raw juice, raw vegetable juice in the morning. This is not suitable for everyone. So you should understand your body and you should understand what is good for you. If you are not capable of understanding that, you can get a consultation from any of the nutritionist or any of the physician. Post that you have to consume. Next is recognize your digestive capacity. See, understanding your digestive capacity and having the food is very important. For example, some people in the morning, as soon as they wake up, they don't feel hunger. But as a good regimen, whenever they want a good daily routine, they force themselves to have any type of breakfast before 8 or before 9. That will leads to bloating. If they are not hunger, they should not go for any heavy breakfast. They can go for any steamed fruits, apple or pear fruits they can have, or with a pinch of cinnamon powder, or any light liquid which is cooked food they can have. So this digestive capacity knowing is very important. Whenever you feel less of hunger, but you should not skip your meal, there you should have very easy digestible foods like soups, any soup, vegetable soup, chicken soup, any soup with a lot of digestive herbs, especially pepper powder, cumin powder, and dry ginger powder. That is very essential. Then the second option is khichdi, rice and moong dal, or the green bean, the broken green bean you get cooked with a little bit of vegetables you can have. Third is when you have a less digestion, don't go for any raw salads, even the raw onion. Or you get these salads, raw onion, raw tomato, and all. Don't go for that. That is very heavy to digest. So, understanding the digestive capacity is very essential. Third is mindful eating. You should understand what is there in your plate. That is the first thing. Second is you should understand what is the taste of each and every food in your plate. See, nowadays, corporate lunch or brunch is a very common thing. A brunch is something which we consume at about 11 o'clock, including breakfast and lunch, which is a heavy meal. But what is there in that at that time of the day, whether it is able to digest that and all, we are not understanding. And this corporate or meeting lunch or dinner, whatever it is, we keep on talking. We never understand what is going in the stomach. The plate will be always full. We keep talking. Somebody will be putting food in your plate and you'll eating that, talking. So that is a absent mind eating, which leads to indigestion. So you should be always in a mindful eating. Also, always try to avoid this conversations or screen TV or the mobile, newspaper, all these things while you eat. Because Annam is Brahmana. Annam is which gives life. Annam means not only rice, all the food which gives life. So something which we gives life, we should respect that. So always be in a mindful eating posture or in a state. Mindful eating is a very important. Next is chew down your food. Everybody knows you have to nicely chew down your food because initial stage of digestion or the starting point of digestion is from your mouth. The carbohydrates in your food gets digested or starts to get digested from your mouth. So chewing down your food is very important. And now last is the following the trend, especially this what do you call ABC juice trend, apple, beetroot, and carrot raw. And then second is the banana smoothie trend. These two are really stupid trends, not suitable for everyone. One thing is banana and milk, if you combine together and have a long period of time, there will be a lot of phlegm formation in your body and it is easy to get headache. or the sinus, migraine. That is the last stage. It is not like today if you consume, tomorrow you get the migraine. No, it will take time. Slowly this is getting to lodged in your body. It won't get digested or it won't go out in your body. It won't get absorbed. It will stuck. And slowly it will get more, and somewhere they see, okay, somewhere there is a weak point in your body. They start to attack there. That is the basic thing of banana and milk combination. And the other is the raw ABC juice. Apple, beetroot, carrot juice. Raw thing is not suitable for everybody. See, raw food is very suitable for something. Or raw salads. Yes, I advise raw salads or raw juices for my patient who are obese, who have a lazy routine, who have diabetes also. I observe. I will see their body, how their body nature. Post that, definitely you can go for this raw salads. But people who are lean, who are very tired, who are weak, who have multiple disorders or multiple joint pain, raw food or raw juices is not an option for them. It will increase their weakness, dryness in the body. So that is the basic thing. So don't follow any trend. If you want to try something which you see in the social media that this is good for health, this is good for something, and or if you want to try something, you can try. Make sure you're trying between the 11 a.m. and 3 p.m. These two time, the sun will be little bit brighter. So the body also little bit active, or the metabolic also will be little bit of more in state. So, and try for the very less quantity for 5 to 6 days. Notice how is it? Is your motion is correct? You are not having any vomiting, stomach pain, all those things. Yes, definitely you can try this 11 to 3. Basically, I don't know how many of you know the feeding pattern for newborns. Like once this after 6 months, we start with solid food, right? So slowly we start introducing solid food for them. Any new solid food which you are introducing them is between 11 to 3. So this is the basic thing. 11 to 3 or 11 a.m. and 3 p.m. in between is very important time, because the metabolism of the body is up, the body is active. Whatever things you are giving to the body, it will try to digest. Post that, when you feel like a bloating or something, you can have a digestive tea with the help of fennel seeds, dry ginger, or one piece of clove. You can boil water, you can have, and then have a light meal. So this is the basic of any new food which you want to have. Same thing for the newborn baby. We'll give ragi at 11. After some time, we see baby is crying. We burp, full day, only breast milk. Second day, same, giving ragi at 11. We'll see how it is. At 3 also, the baby is not crying. Little bit ragi we are going to introduce. So slowly at the evening, baby will cry, will burp, do some like ajwain potli massage over the stomach, burping, breast milk feeding. That's it. Nothing else. So this is the best time, 11 and 3. Keep that in your mind. So this is the basic of nutrition. Now, coming to antenatal diet. So in antenatal diet or the pregnancy diet, we have heard always that we should eat for two people, one for mother and one for growing baby. No, you should eat what for one people. Post that whatever the body is able to digest, it will take to the nutrition or the cell formation for the baby. So don't overeat yourself during the pregnancy time. That is one thing. Second is, in pregnancy period, 6 nutrients are very, very essential. They are, this is not there in the PPT, you can note it down. Protein, calcium, zinc, folate, or folic acid is the folate, iron, and iodine. So these six are very essential. If you are planning for any diet for the pregnant lady, trimester wise or week wise, make sure these six nutrients are there in your diet plan per day, not for the week, per day. In your per day diet, the six are included. See, protein, these chickpeas, peas, and peanut, or if you're going for a non-veg, egg, meat, chicken is a source of protein. Calcium, milk, paneer, or the cottage cheese, and then the dry fruits which have calcium, as cashew and walnuts have a little amount of calcium. Actually, spinach, these are the amount of calcium. Coming to zinc, again, zinc, magnesium, and all high source is only you can see in the dry fruits, especially in the walnut and badam. Folate or folic acid, yesterday we have discussed. Pomegranate, blindly you can prescribe a pomegranate to a pregnant lady. It is the high source of folate. Tender coconut water. Then iron, again, amaranthus, spinach, all these green leafy vegetables and the green vegetables you can advise. Iodine, yes, obviously the salt. Salt also you can advise to go for a pink salt. That is kind of leaven, not the ordinary one. So don't overuse it. You can advise to use it if the pregnant lady is having any giddiness or very less tiredness for the day. Any time of a day, you can advise like a electrolyte, like nimbu pani or the lemon juice with salt and water in the salt and sugar with equal ratio. You can advise. So these six nutrients should be there in the diet of a pregnant lady in the day-to-day diet. Now, eat what suits your body. In the first trimester, already the body is trying to adjust with some new formations or the new hormonal secretions. That time, if you try anything to your body new, for example, I don't know how many you know, avocado is very good for pregnant lady. Yes, I do agree, because avocado is having the structure of uterus only. It is very good for the pregnant lady. But how many ladies is used to eat avocado before pregnancy is also very important. Somewhere if you read or see avocado is good for the lady, you should not consume avocado from the first month. Wait, after 3 months, slowly you can start with the avocado. Second is, there are a lot of people who are intolerance with lactic acid, that is the milk. But in throughout pregnancy, we need milk. Cow's milk is very, very, very important throughout the pregnancy. So how you can do this? One way you can do this is, if you know that client before pregnancy only, help them to reduce the lactic intolerance. How? Slowly ask them to, if they have any known cows or known farmers of the cow where the cow is openly grass fed, not this hormonal injected cow, or not this very cruelly extracted milk like that. It is only grass fed and they are giving the milk. That is one way. Second way is, ask them slowly to start milk by boiling 1 glass of milk with 1 glass of water and 1/4 teaspoon of dry ginger powder. Dry ginger powder is very essential. Nicely boil it and reduce to 1 glass. And ask them to use this milk for making chai, or as such you can consume it, no problem, or any other things. So this dry ginger powder helps to digest the fats in the milk. This is the only way which you can help the lactic intolerance. Now, if the lady is pregnant, is lactic intolerant, but you have to advise milk, because milk and ghee is the best remedy for the constipation in first trimester. How you do? Same. You can advise to take this, use this milk, reduce the quantity, have it at 11 a.m. Quantity reducing means not half glass, 1/4 glass, or maybe 2 to 3 teaspoon also. Let her try to consume. But make sure on those days whether she is trying this milk, she is not having more of vomiting. She is not tired. She is little bit active, no vomiting in that day. You can slowly advise this only in the morning time, not in the late night or evening time. So this is, and what suits your body you have to eat is very important, I was telling. Otherwise, if you say milk is good for the pregnancy, you can have to start with milk from the day when the lady is having milk. You are helping her to trigger her nausea, nothing else. She will be vomiting continuously. So milk here, something which you have to give like a medicine. Then sattvic food gives a sattvic mind for the baby. Sattvic food, I am not asking anybody to go for a vegetarian diet or avoid lashun or garlic or the onion in your food. No. Sattvic diet means the food which is having life in them. Seasonal vegetables and fruits is something which has life in them. And non-refrigerated food is something which have life in them. The food which is not heated in oven or not preheated or heated 2-3 times is some food which is having life in them. Warm food. These are the basic examples of sattvic food. I'm not going deep into sattvic thing because there are a lot of concepts of sattvic for every person. So I don't want to hurt anybody's concepts. This is the basic of sattvic food which have life in the food. What microwaved, dry, stale, fried, refined flour, canned and raw food in pregnancy. Throughout pregnancy, she should not take microwave food or dry food. Dry food is these nuts which is not soaked, or the dry meat also you will get, that she should not take. Stale food kept for 2 to 3 days or fermented for long time. Especially this in India, you get this idli batter and dosa batter. Sunday we make idli batter or dosa batter. Till next Saturday, the batter will be there in the fridge. Daily it will be dosa or idli, especially in South India. I'm from South India. I have seen this. That is something as stale food. You should not go for that. If you want something, make it for one day. If you are making the batter today, any batter, even I think dokla also is made by the fermented batter. Make today, finish it tomorrow. Don't keep it for too long. It is increasing the acidity. It increases the inflammation in the intestinal layer. Refined flour, maida, is a best example for refined flour, which has no nutrients, zero nutrients. Food which comes in can, this canned beans, and there are a lot of things nowadays come in can. Don't go for that. If it is no other way, you have to have the canned food or the food which comes in can for cooking. Just wash it 1 or 2 times, remove the slimy and the froth thing, and then try to use it, or otherwise avoid it. Raw food, again, this raw salads or anything raw food, don't consume. Healthy mother without any addiction taking fresh, wholesome, organic food gives birth to the healthy child. So that is the importance of diet in the pregnant lady. Why you should monitor the diet. Whatever the mother is having. Yesterday we have discussed Satmyaja. Whatever a mother is used to have before pregnancy, during a pregnancy, depending on that, the baby's nourishment and the health will be. So antenatal diet is also very important. Now, the food consumed by a pregnant lady, we can have a classification like 3. One part will do nourishment for mother. One part will do the nourishment of fetus. One part will do the nourishment of the breast milk. So the nourishment of breast milk only happens in the last trimester. So that here we are going to introduce few foods which help to increase the breast milk. Now, coming to first trimester. In first trimester, there is a lot of anabolic activities happening in your body. Anabolic means cell formation. So there you have to go for food or food item which is having sweet in taste. I'm not asking any bakery items or all the sweets like gulab jamun, all, not that. Fruits, vegetables, even the herbs have sweet in taste. Once they digest, they produce stomach. Such foods you have to choose for the first trimester. Few examples are apple, banana, pomegranate, vegetables like tomato, beetroot, carrot, pumpkin, starch or the grains like rice. Go for red rice, not the polished rice. Red rice is good. Whole grain bread or pasta, which you can get fresh, like not in the covered one. You get some fresh pasta or bread from the bakery also, where they cook. Nowadays, getting this organic thing is not a big deal. Everywhere you get, in small town also, there are shops. Baked or boiled potato is a good choice of starch. But if the pregnant lady is having diabetes high rate, or once the first after the pregnancy started with the diabetes, you can ask them to boil the potato, refrigerate it for 1 to 2 hours. After that, she can consume it. Not cold. After some time, let her take it out and keep it for some time, and then she can consume it. So this helps to reduce the starch load in the potato. Then dairy like cow's milk, fresh cheese. Cheese also, if you can get the fresh cheese, that is good. Otherwise, don't go for cheese, because cheese is something which helps to clog or cover the cells in your stomach. It is very difficult to digest. Cottage cheese. Cottage cheese is paneer. Paneer also same. Don't consume it daily. You can have weekly twice, no problem. Yogurt. Yogurt which is prepared from fermentation of cow's milk and the curd, not fruit yogurt. Then protein source are lean meat, eggs, pulses and lentils, soya nuggets. Pulses and lentils, if you have, you get gas or gastric trouble. So make sure you are soaking it 6 hours prior, soaking all the pulses and lentil. When you cook it, you are adding cumin, garlic, pepper, and a bit of dry ginger powder. This helps to reduce the acidity and bloating. And you should not pair it with any sour like tomato or lemon. You should not add basically, because that will be difficult. The pulses and lentils will be difficult to digest once it comes to contact with sour. So make sure you're not cooking it together. Then in first trimester, you can use honey as the sweetener, because you will have this lot of nausea, vomiting. For that, honey is the best. Make sure in whatever you're adding your honey, the thing is come to room temperature, not even warm. It is to a room temperature. So that is about the first trimester. So in first trimester, some two main things which we observe is morning sickness and the constipation. Constipation, not everybody will have, only some people will have in the first trimester. So for the morning sickness, you can have what you can have early, as soon as wake up, sip warm water, sip. And if somebody having gastric irritations or the sour belching or the uh, reflexes, you can ask them to have fennel seeds boiled water, warm water. Sip 1 or 2 sip you can have. As soon as you get up, can have anything like a multi-grain toast, 1 bite, or a freshly baked cookies. That is one remedy. Next remedy is ginger tea. Nothing, 1 liter of water you can boil with a very small piece of ginger, and you can sip this throughout the day. This helps to get the digestion easier. Chewing dried ginger. Whenever you feel like vomiting, you can have a bite on the dried ginger piece. Then pomegranate juice with a dash of lemon. See, as soon as you start with the morning sickness or the vomiting or nausea in the first trimester, almost every doctor is going to say to avoid the vitamin C, that is the lemon. because it will trigger for the acidity and nausea, all those things they will tell. But 1 or 2 drops of lemon is not going to harm. If you are completely avoiding the vitamin C, the baby development is not going to happen properly. So vitamin C is also very essential in the body. Vitamin C as such, you can advise guava. Guava fruit is you also something which you can advise in the first trimester. Puffed rice or dry fig or black crescents and tender coconut water will also help to reduce the morning sickness and the tiredness in the first trimester. Puffed rice is not that murmura, something which we call laja in Sanskrit. Parched rice is no, it is called. After this discussion, we'll have some images of from the Google. Parched rice it is called. It is not the murmura. So you can boil it. Once you feel like 1 glass of puffed rice, 2 glass of water with a little bit salt and dry ginger powder, boil it. You can have this. My professor was having a patient and she was having hyperemesis gravidum where she was admitted to hospital. In a allopathic hospital, she got admitted. She was on a IV, and we tried every way to stop the vomiting. It was out. She was on IV, but still, our ma'am told her to powder 1 tablet nicely powder just to smear in the lips, and she was taking that. And this puffed rice water, their parents was dipping a cloth in this puffed rice water and was giving through the cloth to the mouth. So within 2 days, the IV shots was over and she was fine. So that's how we treated one hyperemesis gravida. Half teaspoon of ginger juice plus 1 lemon juice and 1 teaspoon of rock salt for licking. This also when you feel a lot of vomiting or this nausea, that is before vomiting feeling, you can just mix this and have lick by lick. Then dry chutney of pulses or wet chutney of coconut and garlic having in the morning for any breakfast helps to reduce the vomiting throughout the day. Then sniff freshly cut lime and coriander or mint leaves. So that is something cuts the nervous impulse. No scientific relation with the vomiting. For constipation, boiled and cooled milk, nothing else. And in first trimester, if the lady is feeling too tired because of vomiting, less electrolyte, you can ask them to have 1 glass of half teaspoon of ghee and 1 teaspoon of honey. Boiled and cooled milk it should be. This combination will help to increase the electrolyte in the body. Tender coconut water also. And people who are having morning sickness, you have to divide their meals. At the stretch, you cannot
I am unable to see and hear anything.
Hello.
Ma'am, yeah. I
Now
think
now we can, now, yes, we lost you for a few seconds.
I am really sorry.
No, it's okay.
Oh, ma'am is there? Hello. I think Ruchika ma'am is not there. So I have the screen, but don't worry, this PPT will be given to you. I will just discuss the other things. Okay. So the first trimester electrolyte imbalance we were discussing, we have mentioned that you can go for the honey and milk and the ghee recipe. And then the second is the constipation. You can go with the boiled and cooled milk. So these are the basic things in the first trimester. For morning sickness, for constipation, you can use. Coming to and in first trimester, few more things. If the lady is feeling very tired, go for more of liquid food. Nothing else. That is the best thing. More of liquid food means morning you can ask them to have mung bean soup. How you cook mung bean? 1 part of mung with 10 to 12 parts of water in an open vessel or in the pressure cooker. Cook it nicely. Take the liquid part, consume it repeatedly with spices. And then you can use puffed rice soup. Then you can use vegetable soup. So these will help to, the food also will go inside. She will get strength for the first trimester. And in first trimester, reduce the quantity, not reduce, make it sure you are not asking them to take sesame seeds and peanuts, because this is something again which causes hotness in the body. Sesame seeds and peanuts in salads and all, 1 to 2 pinch of sesame seeds and a little bit of peanut powder is okay, no problem. But a patient or the client is earlier history of repeated abortions, don't take risk. Just ask them to completely avoid it. In PPT, I have mentioned reduce the quantity, but make sure if the client is having multiple abortion history, don't ask them not to take only. Don't take any kind of risk. Then avoid taking hot food, hot water, hot sizzlers, anything hot is going to cause contractions in the stomach muscle. This contractions can helps to pull out or take out the embryo from the uterus. It gives a contract. See, while giving birth, we need contractions. So avoid taking hot food. Try to go for warm food. So these are few points about the first trimester. Coming to the second trimester. In second trimester, we can see most of the organ formation happens in the second trimester. So iron, omega-3 fatty acids is very important. Also, by the end of second trimester, that is almost like 6 to 7 months, you can see constipation hits. So high fiber food is very important. Grains such as whole grain you can advise, oats you can advise, no problem. Oatmeal, this is oatmeal with milk or almond milk. If you are using, ask them to reduce the quantity, or else coconut milk is the best choice. Cow's milk is the best choice. After cow's milk, coconut milk is the good one. Almond milk is again little bit of hot, like increases pitta in the body, which is not good in the pregnancy. Red rice you can use, or even you can make ganji out of red rice and milk. Then dairy, butter is the best thing. Dark leafy vegetables like fenugreek leaves, mustard leaves, amaranthus, coriander leaves, mint, turnip green, spring onion, radish leaves, these all you can use. Mustard leaves, I have not used it much. This is something which my professor also advised to patients to use it less, not more. Mustard seed is a very good content of iron and omega-3 fatty acids, but who is not habituated to having mustard leaves? Because I think in north, when you go towards this Srinagar, Himachal, Kashmir, like that, sarson ka saag is the basic sabji which they make. It is little bit hot in nature, so make sure you are not using it too much, because too much of hotness in the food is not good. So winter season you can use, otherwise weekly once is the good option. Iron rich vegetables are tomato, beetroot, pumpkin, sweet potato, drumstick and lotus stem. Potato skin, that is baked potato skin, are also good source of iron. Baked potato skin, not fried or deep fried, baked. Or otherwise, all these nutrients you will get from sweet potato also, no problem. It is not going to increase the insulin or the blood sugar. Then lentils and pulses, you can advise tur dal, Bengal gram, chickpeas, kidney beans, soya beans. Everything should be soaked, cooked with a lot of digestive herbs. Fruits, you can advise pomegranate, black grapes, not the resin, the black whole grapes. apricot as the fruit, plums also as the fruit, strawberries, avocados. If she is not used to avocado also, slowly you can start introducing avocados in the second trimester, no problem. Watermelon and grapefruit is a good source. The non-vegetarian lean meat, eggs, fish and shellfish you can advise. But shellfish, if you are going to advise, make sure she is not having any type of allergy. Not to the shellfish, any type like dust allergy, pollen allergy, or simply skin rashes she is not having, then you can advise with the shellfish. Otherwise, don't go for shellfish. Shellfish is something which causes easy allergy in our body. Who is prone to having allergy, if they are consuming shellfish, they will get these skin rashes very easily. So make sure you're seeing all these factors. Then nuts like almonds, pistachio, cashew, groundnut, walnut, fig, sesame seeds, chia seeds you can advise. Everything in a less quantity. As a sweetener, you can use jaggery. Jaggery, that is palm jaggery you can use. Jaggery is the good source of iron. Palm jaggery. So these are the second trimester food. And now in second trimester, few important parts is, first we will talk about Daukritini. That is in second trimester we tell the lady is having two heart, especially in the 5th month. That is when the baby's heart is developed, the lady is also will be having, pregnant lady is also will be having a lot of cravings. During the whole pregnancy, she will be having cravings, but especially this 5th and 6th month cravings, you should fulfill it. However, not healthy it is, you should fulfill it, because there we are going to fulfill the baby's craving. We are going to give the insurance for the baby that here we are outside people, whoever, mother, father, whoever we are, here we have to hold your hand. So whatever cravings the lady is getting on the 5th month, you should fulfill it. However unhealthy it is, if she is craving for pizza, you should advise them. It is an unhealthy food, but you can have in a less quantity. Make sure less cheese, more of vegetables and a thin crust. No problem for that. Ice cream, again you should advise, you can have it no problem, but in the daytime in a less quantity without any fruits. So see what is a craving, accordingly make it healthifier in your version advice you can have. After that also, if the lady is having some types of cravings like this, advise this is not a healthy craving, but have it in a very less quantity. It is not good for your baby. You have to fulfill it. And in 4th month, you can have a lot of butter in the food. So can anybody tell when the brain will get developed, brain development in baby, when it is? I hope your anatomy classes are over, right?
From the 4th month.
Yes, right. Very good. So the butter is the only thing which helps to penetrate the placental membrane and goes to the baby's brain. So 4th month consuming of butter is very essential for improving the brain strength of the baby. Here I have mentioned 12 gram, but nowadays for the lady's weight, we cannot advise 12 gram because she is going to be a overweight only. If you get that pure butter from the curd, when you churn it, you'll get the pure butter, you can advise. Otherwise, ask them to continuously use butter for 7 to 12 days in every meal. So that is one way you can advise. Then meat soup, moong bean soup is a good source of protein which you needed in the second trimester because of the organ development and the muscular tissues. Then coming to the, I think 6th or 7th month, mostly on the 8th month also, you can see this pedal edema. That is the swelling in the feet region or the ankle region. So that time you can advise to have barley water. And also this angle movement or the asanas which involve a lot of angle movements, you can advise. And also you can advise these angle movements when they do, you can advise them to keep a tub of warm water, dip their feet in that, and you advise the angle movements, whatever the angle exercises which ma'am is mentioning, rotation and all, you can advise that. So that will also help to reduce the swelling. Now, coming to the third trimester. So in third trimester, from the third trimester, we are preparing the mother for delivery, and also we are preparing the mother for breastfeeding. That is, we have to make sure mother is having food which increases the breast milk. So it is very important to have calcium and vitamin K. See, after delivery, from till up to 1 year of the baby's life, the one drop daily it is going is vitamin K drops. So every baby is born with vitamin K deficiency actually. So they will give this vitamin K. So make sure the lady is also consuming leafy vegetables. Cabbage is a good source of vitamin K, and green beans. What you call in Hindi is fancy. Green beans. Then fruits like grapes, figs, and when she comes to 9th month, almost near to her delivery date, even you can advise pineapple. Because once she comes to her date, after 36, 37 week, we want to induce contractions. Before that, we don't want her to have contraction, but once she comes to 37 weeks, we want to induce contraction. So don't go for raw papaya. That is a bad idea because the resin is a little bit heavy to digest. You can have a ripe pineapple. It is not going to induce the contraction immediately, but still somewhere it will help. Then milk, curd, paneer, and ghee. Ghee is something for the third month is very essential because we should reduce the vata in the stomach and the abdomen. Then only the pushing, or the if they are having a like a C-section also, there should not be any complications for the baby's movement. Should have ghee in the diet. So when the baby is on going for delivery 1 or 2 days before that, once she covers a 37 week, you can advise to have one meal, rice soup or ganji with half to 1/4 to half teaspoon of ghee in that. If she is not like a very good fond of rice soup, you can advise to have any soup, green gram soup or vegetable soup, but rice soup is the best thing. If she is admitted to the hospital for the delivery, from there they will give rice soup. In south side, they will give, north side, I don't know what is there on the hospital diet. Carry a little bit of ghee with you, add in that and have. This will help to give strength for pushing also. See, especially in this first time pregnant lady, it won't be a selective C-section. In many cases, they will try for the normal delivery. They have to undergo all these normal delivery process. At the last stage, doctor will tell this is not happening, we'll go for C-section. So from our side also, we can try having this rice soup with ghee. Then dry fruits like date, almond, walnut, and fig you can use. Green gram from the third trimester, make one with green gram, either sprouted and cooked, or like dry sabji, cooked dry sabji, soup, any form. Green gram should go into your body, or the powdered chila, any form, because it helps to increase the breast milk. Fenugreek also very less in quantity you can have from the starting third trimester. And oats, you get different types of oats, high fiber oats and all. You can go for a high fiber oats because we don't want constipation in the last trimester. So in the ninth month or the last month, preparing for delivery and lactation, that is having a lot of ghee and moong dal, moong bean in the diet. Include ghee in every meal from the 32nd week without absence. Make sure the lady is not overweight, not having cholesterol. Accordingly, you have to adjust the dose of the ghee. I have not mentioned the dose of the ghee. You have to adjust it. You can go up to 1 teaspoon also, no problem. But the dose should be adjusted. Time of conception also should be adjusted. If she is not having a good appetite and you are asking them to have the ghee in the night, it is going to give them a indigestion for the next 2 days. So time also should be adjusted. And also in the morning, they had some ghee paratha or anything, chapati with ghee. They are feeling little bit of bloated or less appetite. Ask them to sip dry ginger water. It will get digested. Then, so this is something which is very important in the 8th month. So in the 8th month is very important in a pregnant lady's life. 8th month is somewhere where the immunity is unstable. Either it will be with mother or it will be with the baby. It will be always traveling. It won't be stable. So 8th month delivery is very crucial. And in 8th month, you have to advise, don't go for all these long drives, bumpy road drives. It is not safe. So Swarna Bharati Jal is something which we practice for having a stable immunity for the 8th month. How you prepare, you can note it down. If the person is having metal allergy, that is, some people have metal allergies like to mercury, arsenic or gold, you cannot advise this. Other people you can advise 1.5 cup of water. 1.5 cup of water. Put 1 gold ring. This gold ring should be washed properly, thoroughly washed, and it should not be mixed with cadmium or other metal. See, this 24 karat gold you can take, but this 18 karat or 22 karat gold you cannot take because it is mixed with alloys. Put a gold ring in that and sim the gas for 15 minutes. It will start to get warm slowly. It will start boiling. 15 to 20 minutes, it will start boiling. And after 20 minutes filter it and you can consume this in a warm stage. So this water is known as Swarna Bharati Jal, which is important to maintain the immunity in mother or the baby in the 8th month. You can practice this only in the 8th month and not daily. It is not advised daily. Weekly 3 times is enough.
Can it be had any time in the day or you preferred mornings or so?
Mornings, only in morning. See, all these new experiments only in the 11 or the 3, between 11 and 3 anytime. Then 8th month, again, porridge with cereals, porridge with milk and ghee, or red rice cooked with milk. All these things which is give a little bit of strength to the mother, we have to give in the 8th month. Then coming to the 9th month, again, some people which have the vomiting in the 9th month, high constipation in the 9th month. So rice porridge with ghee is a good option for both of it. And for vomiting in the 9th month, boiled and cooled milk with 1 pinch of cardamom and raw sugar can have in breakfast. Make sure after this milk drink, you are not having any fruits or any food which is having salt. Wait for 45 to 1 hour after the milk drink, then you can have your food. So this will help to reduce the acid reflux. Once you come after 8 months, acid reflux will be your friend in the pregnancy. So these are some of the things. And Indian pennywood or gotu-gola. If you search in Google, you will get as Brahmi as the tree, but it is not Brahmi. It is Indian pennywood or gotu-gola. It is. Somebody from Andhra Pradesh? No. So in the 4th month, when the baby brain is development, Indian Gotu Gola or the Indian pennywood, if the leaves is available, this is not available everywhere. If the leaves is available, you can consume it in a sabji form. Like how you make spinach, same like that you can make a sabji of this Indian pennywood. So this will helps to increase the brain function for the baby. More than Brahmi, we use Indian pennywood or Gotu Gola for as a memory tonic. For a stable woman, a stable person. Brahmi is, we can use, it is help for a memory tonic and all, but some conditions are there to use Brahmi. Indian pennywood, there is no condition. You can use for 1 week, continuous 4th month, continuously for 1 week, you can advise to have sabji with Indian pennywood or Gotu Gola. When you see, I think Brahmi also was saying, but this is something a different leaf, very small, lightish green it is. You feel like a umbrella under which the frog is sitting, like that the leaf will be. It is a very small leaf. So these are some of the diet advices in the pregnancy.
What is that good for, ma'am? The Gotu Kola?
It is a memory tonic. Gotu Gola have other ingredients. It is high in antioxidants. Nowadays, you get face cream or face serums in which is prepared from Gotu Gola actually. It is act as an antioxidant.
So it's good in the 9th month.
Yes, no, not in the 9th month. In the 4th month, when the baby brain is developing, is happening. 1 to 2, 1 week is enough. You can advise to have some sabji from that. And always understand pregnancy is not a disease. It is a mere line between a health and a disease. A doctor, there is one Ayurvedic saying for the pregnant lady. Sorry, I forgot the saying, but saying is pregnant lady is a one healthy person under the supervision of a doctor. So that is the base. So all these diet, medicines and all is important. And in pregnancy, what we practice from the South India especially, we give milk decoctions with the medicines. But that is depending on the lady's health condition. Blindly, we cannot use that. So I don't want to discuss that. Any doubts is there?
Ma'am, I have a question. Can I ask?
Yes, please.
Yes. Ma'am, if a lady has a weak digestion, then can she consume salads, raw salads like tomato, beetroot,
No.
cucumber?
No, see, weak digestion, there is only there. Not a pregnant lady. Anybody who's having a weak digestion, don't go for raw salads. If she wants something, a salad, make it cooked. Add little bit of pepper powder, cumin powder in that, dry ginger powder, consume it. No problem.
Okay. Ma'am, steam cooked like that?
Steam cook.
Carrots or beetroot steam cooked?
Yes, steam cook or even you can cook in pressure cooker. No difference.
Okay. And for tomatoes also, no, ma'am? Tomato, cucumber.
Yes, tomato, cucumber, if you cook, you don't have that good taste. Try to avoid cucumber in the weak digestion. Once it is stable, you can go for the cucumber. Even you can have it raw, but make sure you are not using it in the morning. Midday is the good.
Okay. Or any fruit juices, ma'am,
For weak digestion.
for weak digestion?
No, weak digestion, don't go for any fruit juices. But if she wants something fruit, you can advise steamed. Idli cooker steamed apple and pear with a pinch of cinnamon powder.
Okay.
That you can advise.
Ma'am, if one more question, if some cases I have seen that lady has nausea throughout the pregnancy,
Yes.
so then all the trips for that morning sickness, this will help, I think.
This will help. Also advise her to have puffed rice. puffed rice will be her best friend if she is having throughout the pregnancy. Sorry, I'm not able to share my screen. Otherwise, I will just Google
This is
and
murmura, ma'am.
Rajeshri,
no, it is not
maybe
murmura. It is not murmura.
Yeah. I'm not able to understand what it
I
is.
will. I will. See the.
Rajeshri is the host. If she can make you the
Can
host,
you
you should
can you
share.
see me? This some brown thing will be there. Murmura won't be having this brown thing. This we call as parched rice. This is not murmura, this is parched rice. It is available. This is the actual picture actually. Parched rice, if you search, you will get.
Okay, okay, got it, got it.
Yes.
So what's the best way to consume this? Is it like to make it with, mix it with?
You can boil it with 1 glass of this puffed rice, 2 glass of water, add ginger powder and little bit of salt, and you can use it as a soup. That is one way. Cook it and have. Don't have it raw. But if the lady is having some murmura or chaat feeling to have, you can advise this instead of murmura. Murmura will cause you a little bit of gas. This won't cause gas. So this boiled water is best friend. Throughout the day, ask her to boil this like 2 to 3 teaspoon in 1 liter of water. She can boil with a pinch of dry ginger powder. Filter it, store it in a thermoflask. She can consume this warm throughout the day. For the
Remaining, ma'am,
sorry,
remaining that parched rice, remaining form.
either she can take it or you can throw it. No problem.
Okay.
That will help to reduce the vomiting throughout the day. Any other doubts are there?
For banana, you said it shouldn't be combined with milk because it causes the phlegm, right? So nowadays people use the almond milk or even coconut milk, like you mentioned. Is that okay? Do we?
Cow's milk is the villain for banana actually. Coconut milk or almond milk you can use, no problem for that. Cow's milk actually, because of the fat, see, in cow's milk you extract curd, ghee, butter. So this much of fat content is there in the cow's milk. So that is very difficult to digest. So above that you are adding banana, which is again difficult to digest and cold in property. That will get lodged. You can use coconut milk to make your smoothies, no problem. Almond milk is again little bit of hot in potency, but you can use. See, this is gotu gola. You can see the leaves like an umbrella it is. So this, if somebody sees, usually in the rainy season, the roadside you will see. I don't know how much you see in your states.
Ma'am, what is the best time to have coconut water, tender coconut?
Any water or fruits, the best time for everyone to have is from 10 to 4.
Did you say any water or fruits?
Any water or fruits, yes. Once you steam your fruits, apple or pear, it is steamed, you can go for the evening time as 5, 6, 7, 8, 9, no problem.
But not early morning because, as you
No.
said, some people say first thing in the morning, empty stomach,
No,
fruits.
don't consume anything in the empty stomach. Warm water is the best friend for the empty stomach. If they are having any acid reflux or any condition, you can adjust that with herbs. Fennel seeds, coriander seeds is the best friend for the acid reflux. If the lady is having bloating, ajwain, that is carom seeds, boiled water is the best friend. If the lady is not having constipation but having digestion issues, cumin seeds is the best friend. Or otherwise plain warm water. Break your fast. It is not before breakfast, you have to break your fast of how many hours, I don't know how you practice your dinner and morning. Break your fast with a sip of warm water.
Fennel seeds and cumin seeds are good for digestion.
No. Fennel seeds and coriander seeds, good for acid reflux. Cumin seeds, if the lady is not having thyroid and constipation, you can use cumin seeds. Any other doubts are there?
Ma'am, that flax seed, who
Huh.
should consume and who shouldn't?
Flax seeds don't give in pregnancy time. Flax seeds, if the lady is, see, before conceiving, that is before pregnant, we have to see her 3 cycles is normal. On the 4th, after 3 cycles, you have to advise for the conception. Minimum 2 cycles, you have to see it is normal. So in this 2 cycles period, after 14 days of ovulation, you can advise flax seeds and sesame seeds. Once she is conceived, forget about flax seeds. Flax seeds is a no. Even though it is a high source of vitamin C, omega-3 fatty acids, and a lot of other things, it increases heat in the body. So don't consume flax seeds, because see, being a yoga instructor, how much you have to understand the medical knowledge is also important. So don't take any risk. Just forget about flax seeds in the pregnancy period.
Same with sesame seeds, or sesame seeds reduce?
Sesame seeds you can use if, but there also contraindication is if the lady is having a history of continuous abortion. Even though one prior pregnancy she got aborted, something like that, don't risk, don't use sesame seeds. Other than that, you can use very 1 or 2 pinch in the top of salad. Not that sesame nutty bar or sesame balls. Don't go for that.
Ma'am, in general, what should we use for diabetes?
Sorry?
In general,
Huh.
if a lady is having a diabetes, so what should we use for it?
See, in diabetes, you can categorize as high diabetes where she is taking insulin.
Not high, ma'am.
Other than that, you can
Yes.
actually, in diabetes, even I advise my patients rice also in diabetes, but you have to control their diet. You have to see they are having a good lifestyle and a good diet and a good sleep. If these 3 are there, you can advise anything to your patient. Even dates, fruits, mango season comes, I advise even mango. There is no increase in the insulin. So something specific for diabetic is not there. You have to tailor your diet. That's it.
Last question. If any lady has trouble sleeping, anything can be done for that through diet?
Yes. So if the lady is pregnant, you can
Yes.
advise only warm milk for the night and the feet massage. Feet massage under the feet, you can ask to rub with a little bit of oil, ghee or butter. That is good. Or you have to concentrate on the diaphragmatic breathing. Lie down supine. Just focus on your diaphragmatic breathing, how they are breathing. If the lady is not pregnant, you can advise for nutmeg milk. Nutmeg powder you get 1/4 teaspoon powder. You can mix it in the milk, have in the night before bed. That is a good thing for the sleep. And also you can advise them to have a calming pranayamas and the yoga nidras. And also Brahmi Thaila, usage of Brahmi Thaila as keeping here in the here, this point, center of the head, this point, you can ask them to keep. These all helps to calm the mind and avoid doing Shirshasana in the insomnia conditions. This will be contraindicated with some people, but controversial for some people, but avoid using Shirshasana, because once you go for Shirshasana, this part is getting stimulated, this is getting active, where in insomnia we are trying to calm this part.
Oh.
So that is something which you can do for the sleeplessness. Also understand the condition, why she is not sleeping. That is also very important. Maybe with the stress, with some disease, the pain or something, advise accordingly to that also along with these tips.
Nutmeg milk only for non-pregnant ladies.
Nutmeg again. See, these spices and all is good for pregnant ladies, but we don't know how she is going to act to nutmeg while she is pregnant, especially in the night. We cannot give. So it is not good to advise nutmeg plus milk in the bedtime for the pregnant ladies.
Otherwise, like in normal cooking, we use
Ah.
sometimes, that's fine, right?
That is fine. If she is used to it, nutmeg powder, no problem. Even she can have like a 1/4 teaspoon of nutmeg powder milk in the night, or reduce the quantity and see for the initial days. See, something after 4 o'clock, you are doing experiment. So how we do experiment in very less quantity to understand what is happening. So like that you can do. Okay, any other questions?
For back pain, can they go for little oil massage? Maybe if legs and thighs are paining for a pregnant lady.
Oil massage, yesterday we have discussed, right? In the
Yes.
first 5 months, how should be? Post 5 months, how should be? 6th month, how should be? You can practice this. Other than that, if she is having any body pain or back pain or anywhere, you can apply any liniment. Liniment is something which is a mix of herbal oils and the camphor and menthol. So you get good liniments from a lot of various pharmacy, Himalaya or any pharmacy you will get. Just smear the liniment. The menthol will act very well. The pain will be reduced.
Thank you, ma'am.
Okay. Anything else is there? I hope I have covered your doubts. So Monday we'll discuss with the postpartum. Again, I'm telling go to 2 classes. Any doubts on Monday also we can cover. Okay. Thank you. Nice seeing you all.
Thank you.
Good weekend. Bye.
You too.